tell me how. I'm not at all surprised that you wound up in this highly complicated, complex chronic disease model, but was there anything that really specifically drew you to it, or was it just that this is kind of where you got to explore the most medicine in a sense?
Yeah, it's a really good question. I think I didn't expect to necessarily fall into it, and there's a couple things to consider. For one, they will say sometimes that a certain type of patient may find you if you're a good fit for that patient, or if you're maybe a good constitution for that type of patient, or whatever it may be. And that even goes way back with the idea of the healer or the shaman, people finding you that are meant to find you for the support or help that they need. So there's that part about it. It's kind of like a calling, but also I have been really fortunate to have I joined a practice that was really treating complex chronic. It was a family medicine practice around 2015 or so. And that really kicked things off in a big way because suddenly that was a place that I was encountering a high volume of those people
Yeah.
versus maybe before I'd see one or two here and there or something like this. And I didn't necessarily have to, in that prior practice, get as deep with them because maybe I was just dealing with a certain aspect of their care. Maybe I was their primary care physician because I was doing primary care prior to that and in the state of Washington. So it was just a progression, I think, as I started to dive deeper into complex syndromes and just an individual's multi-systemic issues. More than one body system is not regulating correctly. It was just sort of a logical progression. And I think it's also been the drive to learn and understand, which I think you need to have that because a lot of people get into this complex chronic world, but they don't last more than like 2 or 3 years. It's easy to burn out.
Yeah.
You really have to want to do it. It's not something that you just do.
Yeah.
At least I don't think so. And I've heard other doctors, of course, in the conventional world say, well, you guys are just basically trying to take money from people or something. I was like, well, even if it was just about the money with people, it's not enough money to deal with the level of energy and care that you need. It's not like a cardiac surgeon or something.
I know. Isn't that astonishing?